Good day, nursing students. Welcome to Wally's Nursing Videos. Today, we will be delving into the fascinating world of acute neuromedications and their application in the management of spinal cord injury. Our focus will be on key medications, their classifications, indications, mechanisms of action, adverse effects, contraindications, lab monitoring, and important nursing considerations. Baclofen, lioresal. Classification: skeletal muscle relaxants. Pharmacologic class: gamma-aminobutyric acid derivatives. Prototype: baclofen, lioresal. Indication: spasticity in multiple sclerosis, MS, and spinal cord injury. Mechanism of action: MOA. Baclofen is a centrally acting muscle relaxant. It is believed to mimic the action of GABA, an inhibitory neurotransmitter, on spinal neurons within the CNS. This hyperpolarizes fibers, reducing impulse transmission and decreasing muscle spasms in patients with spinal cord lesions. Adverse effects: CNS depression, including dizziness, drowsiness, weakness, and fatigue, as well as respiratory depression. Gastrointestinal symptoms like nausea and constipation may occur. Contraindications and cautions: be alert to life-threatening CNS depression, cardiovascular collapse, and respiratory failure when used intrathecally. It may impact a few labs like CK, glucose, and leukocyte counts. Use with caution in renal patients, and monitor renal labs. Lab monitoring: check renal labs, monitor sodium levels and respiratory status. Nursing considerations: administer with food or milk. Caution patients about abrupt discontinuation, which can lead to hallucinations. Emphasize the need for safe driving and avoiding alcohol consumption. Dantrolene, Dantrium. Classification: skeletal muscle relaxants. Pharmacologic class: hydantoin derivatives. Prototype: dantrolene, Dantrium. Indication: treatment of spasticity in patients with severe chronic disorders, such as MS, cerebral palsy, spinal cord injury, and stroke. MOA. Dantrolene acts directly on skeletal muscle, decreasing excitation and contraction coupling, and reducing muscle strength by interfering with intracellular calcium movement. Adverse effects: hepatotoxicity, anemia, thrombocytopenia, leukocytopenia, depression, and gastrointestinal bleeding. Contraindications and cautions: dantrolene carries a black box warning when used with opioids and CNS depressants. Monitor platelets, WBCs, and hemoglobin levels. Lab monitoring: liver function should be monitored closely. Nursing considerations: instruct patients to report fatigue, malaise, or CNS changes. Advise against driving and alcohol consumption. Educate the patient's family about potential adverse reactions. Diazepam, Valium. Classification: benzodiazepine. Indication: management of spasticity in conditions like MS, cerebral palsy, and spinal cord injury. MOA. Diazepam mimics the actions of GABA, an inhibitory neurotransmitter in the CNS. Adverse effects: CNS depression, including lethargy, sedation, and respiratory depression. Cautions: tolerance may develop. Also used in managing acute seizures and cerebral edema. Nursing considerations: tolerance may develop. Cerebral edema, hypertonic sodium chloride. Indication: cerebral edema. Mechanism of action: these hypertonic agents pull water from the extracellular fluid space into the intravascular fluid space, reducing brain swelling by increasing sodium levels in the bloodstream. Adverse effects: fluid volume excess, FVE, refractory intracranial hypertension, and pulmonary edema. Cautions: raise sodium levels slowly, no more than 10 mEq, 24 hours. Lab monitoring: frequent monitoring of sodium levels, serum osmolarity, urine osmolality, and respiratory status. Nursing considerations: monitor intake and output, I&O, sodium levels, respiratory status, neurostatus, level of consciousness, lock, and basic reflexes. Often given with Lasix to facilitate diuresis. Be cautious about the possibility of solution crystallization in cold environments and use filter needles and IV tubing with inline filters to prevent this. Avoid extravasation. Mannitol, osmotrol. Classification: diuretics. Pharmacologic class: osmotic diuretics. Indication: treatment of cerebral edema. MOA. Mannitol increases the osmotic pressure of glomerular filtrate, inhibiting tubular reabsorption of water and electrolytes. It elevates plasma osmolality and increases urine output. Adverse effects: life-threatening effects may include seizures and heart failure. Other side effects include dizziness, headache, hypotension, pulmonary edema, and electrolyte imbalances. Cautions: use cautiously in patients with heart failure, HF, and renal disease. Lab monitoring: monitor labs and fluid balance closely. Auscultate lung sounds. Strictly track intake and output, IOS. Nursing considerations: watch for crystallization of the solution in cold environments and use filter needles and IV tubing with inline filters to avoid it. TPA alteplase, activase. Classification: thrombolytics. Pharmacologic class: protein. Indication: ischemic stroke. MOA. TPA alteplase is a protein that lyses unwanted fibrin blood clots by converting plasminogen to plasmin, making it the first-line treatment in select stroke patients. Adverse effects: the main concern is bleeding, and aminocaproic acid is the antidote. Contraindications: avoid in patients with uncontrolled severe hypertension, aneurysms, AV malformations, known coagulopathy, internal hemorrhage, intracranial, spinal surgery within the past 3 months, use of anticoagulants, recent major surgery, trauma, or intracranial mass. Lab monitoring: monitor INR, APTT, PT, platelets, and fibrinogen. Perform baseline and post-therapy checks to assess fibrinolysis. Nursing considerations: keep an eye on patient stabilization, reversal of symptoms, normal mentation, and the absence of bleeding complications. Remember that administering TPA requires specialized training and experience. In conclusion, these medications are crucial tools in the management of spinal cord injury and other related conditions. It is imperative that nurses understand their classifications, indications, mechanisms of action, potential adverse effects, and the importance of close monitoring. Always exercise caution, follow safety protocols, and educate patients and their families regarding these medications to ensure the best possible care. Thank you for your attention, and please feel free to ask any questions you may have.